So I'm here with Professor Fruzzetti from Reno, who is presenting today at the Karolinska borderline seminars. I would like to ask you, what would your advice be to a person who thinks she or he might have borderline personality disorder?
Well, that's a good question. I think the first thing for the person to do is to get a good evaluation, go to a clinic or to a therapist who specializes in treating borderline personality disorder. Somebody who can make a good evaluation. There are lots of errors that people make diagnosing and assessing borderline personality disorder. It's often confused with other disorders and other problems. Sometimes people with BPD, as we say, borderline personality disorder, sometimes they get misdiagnosed as having bipolar disorder or other kinds of problems, and sometimes people with other kinds of problems get misdiagnosed with BPD, and of course we want to have an accurate assessment so that we can do the best job maximizing treatment.
So for someone who is correctly diagnosed with borderline personality disorder, is there a good treatment?
Well, the good news is that this has really been improving in the last 20 years. 20 years ago, there wasn't a single treatment that had what we would consider to be a high standard of evidence that it works. Not a single randomized study had been conducted for this group of patients. But now we have many. The vast majority of those studies have been supporting a treatment called dialectical behavior therapy, which was developed in the States by Dr. Marshall Linehan and has been studied now for almost 20 years. There are more than 12 or 15 randomized controlled studies of DBT, comparing DBT to ordinary treatment in community psychiatry and other kinds of psychotherapy, and it's clear the standard of care at this point. There's very good evidence that it's a good treatment. There's more recently there have been one study to suggest that another treatment called schema focus therapy might be useful, but just one study. We're very hopeful that that will turn out to be very useful because it gives patients more options. And similarly, one study showing that a treatment called mentalization, which was developed in the UK, one study showing that to be very promising. So we're hoping that these two treatments will continue to develop so there'll be more options and for borderline patients. Right now, the treatment with the best evidence is dialectical behavior therapy.
And could you, in a few words, describe what dialectical behavior therapy is?
Well, I doubt I could do it very well in a few words, but the essence of dialectical behavior therapy is to help patients with borderline personality disorder learn to manage their emotions differently. In DBT, as we call the treatment, we say that the main problem of borderline personality disorder is that patients have difficulties regulating or managing their emotion, that they have they're highly sensitive and reactive, and sometimes have had quite a lot of difficult things in their lives to deal with and have a lot of negative emotion and so forth. And so DBT is designed specifically to help people manage their emotions. And there are a number of different things we do, both tried and true behavior therapy strategies, but also lots of what we call mindfulness practice, learning a lot of skills to manage. And also the therapist can be, of course, quite supportive in this treatment and helping patients to make progress.
What advice would you give someone who lives with someone who has borderline personality disorder?
That's a very good question. I think it's a very big group of family members, partners, parents, siblings, and sometimes there's some suffering associated with that. Sometimes it's simply the suffering that goes along with having a loved one who himself or herself is suffering. And sometimes there's a chaos and a lot of conflict and difficulties associated with that. And so I think it's important for families to get support and to learn about the disorder. There are different ways that families can do that. They can go to family therapy, family programs. If they're in dialectical behavior therapy, those kinds of programs often have programs for families. And then there's also a program that's starting to expand around Europe and the States called Family Connections, which is a specific program developed for families who have a relative with borderline personality disorder. And in Family Connections programs, we help family members understand the disorder and understand the development of the disorder and learn a lot about that, and also teach them a lot of different skills for how to manage things, not necessarily just with their relative with BPD, but difficult situations. And obviously, because it's done in a group, there's a lot of support as well.